what do we need to do in order to prevent disease?
The machine is paid when you're sick, not when you're well.
What did your research indicate about sugar?
It is probably more addictive than cocaine and heroin, right?
The conversation has to be micro conversations around preventative living.
If information is free, why is it that we have these health issues in America?
Hi everyone, from Round Glass, this is Living with Sunny. I'm your host, Sunny Singh, with my friend Thomas Power. Hi Thomas. Today our guest is Dr. Dung Trinh. Dr. Trinh is the Chief Medical Officer at Irvine Clinical Research. Dr. Trinh, you are a very sought after speaker and a thought leader in the area of preventive medicine, a topic very close to my heart. As a matter of fact, when I started Round Glass a few years ago, it was out of my disenchantment with the healthcare system, which was more of what I call a sick care or a disease management system, where if something happens to you, we do nothing or pump you with chemicals or push you under the knife. Now, it's not that the system is not relevant or needed, but it is a business of care, not a system of care. And what I'd love to hear from you as we start is, what do we need to do in order to prevent disease taking place in our body? How do we focus on prevention versus cure?
I share your same passion toward prevention. Having been in primary care medical practice for close to 20 years, here in the US, surveys have been done with patients asking them, how long do you have with your doctor? And I believe it was about 7 minutes, that face-to-face encounter with a primary care doctor. And in that 7 minute, that doctor is addressing their primary concerns, refilling medications, putting in referrals, right, reviewing lab results. Where does prevention even play a role in a 7 minute discussion?
That's true.
And it's a huge issue that I see. Prevention really starts by education, not necessarily, educating patients in a fixed 7 minute time block, but even going outside of that, going to the community. So I think we take it out straight to the patients where they go to at the community centers they live, they participate in, at the senior centers, at the retirement homes where they're at. We take the message out there.
And how would you summarize preventative medicine, Dr. Trinh?
Preventive medicine is really lifestyle, nutrition, how much sleep you get, how much socialization you get, what you should eat and what you should not eat, right? Ways to really reduce damage to your body, right? Reduce inflammation, reduce the harm that we cause to our bodies before that diabetes show up, before the hypertension, the cholesterol issues and all that, before cancer. I think most of it is lifestyle, a lot more than just genetic mutation and your genes.
I tell people the epidemic of our times, as much as COVID, the true epidemic is a modern lifestyle. And that's making us fall off a cliff or heading towards falling off a cliff. So if you talk about tests and metrics, what do you recommend? Where do we start?
Let me give you an example. I do a lot of lectures on Alzheimer's risk reduction. How to reduce your risk for Alzheimer's. I don't know about where you're at, but in Orange County, California, Alzheimer's is the number 3 cause of death, right behind heart attacks, number 1, and cancer, number 2. So what do we measure? How do we assess a patient who wants to reduce their risk for Alzheimer's? One of the metrics we follow is a cognitive assessment, a memory test, to evaluate and get a baseline on how your memory is today. And then we review their health history. We know that if you have conditions such as diabetes, it doubles your risk for Alzheimer's. If you have conditions such as heart disease, hypertension, a lot of the cardiac risk factors are actually the same risk factors as Alzheimer's, actually. There are these identified conditions that are associated with a higher risk of Alzheimer's. We identify them We highlight them for our patients, letting them know that these are your risk factors for Alzheimer's by having these lists of conditions. And here are the steps to reduce those risk factors: getting your blood pressure under control, getting your sugar under control. And then nutrition plays a huge role. There has been published in several articles in different journals a diet that reduces the risk of Alzheimer's. We call it the MIND diet. The MIND diet is a combination of the Mediterranean diet and the NASH diet, which is a heart healthy type diet. In one study, we took two groups of patients. We put one group on the MIND diet, this Mediterranean diet, and the other group on the American diet. We followed both groups over a number of years. The group that was on the MIND diet in one study had a 54% lowered risk of developing Alzheimer's than the folks that were on the American diet. And so these are actionable activities that we can teach our patients. Here is the list of foods from the MIND diet that you should focus on compared to the typical diet that most of us are on. And then we implement that in our prevention program.
So, Dr. Trinh, surely you've done this research, you've published this research, the MIND diet. Why don't people understand it?
Because physicians are busy writing prescriptions.
Wow.
They don't have the time or the bandwidth to simply discuss these facts.
So they're stuck inside the system.
They're stuck inside the system.
And when you sit with your patients and you discuss the subject of the MIND diet with the American diet, what percentage of your patients, your clients, understand?
The majority of them have never even heard of this. The majority of folks don't really realize that there is a diet to reduce your risk for Alzheimer's. And this is why we need to get these types of podcasts that you're doing out there to the public, and it's a mission to provide this information, because obviously the machine and the engine of the medical infrastructure does not provide the bandwidth or the time to provide education on prevention. As a matter of fact, the machine is paid when you're sick, not when you're well.
To the listeners that they're listening to our conversation, let's say, Dr. Trinh, that you're my wellness coach or a wellness doctor or preventive doctor. How should my relationship and engagement with you work?
So I can tell you what the system looks like now, and I'm sure you can relate with it. If I made the diagnosis of Alzheimer's in a patient, I would write them a prescription, and I would tell them simply to come back and see me in 6 months. I have no clue what happens to that patient in 6 months. I have no clue what their daily life is like. I have no clue what their diet is like. So there is this gap between the type of care we give, the recommendation in a simple 15-minute visit, a prescription that's given, and telling the patient to come back in 6 months to see how you're doing, right? So really the question is, how do you fill that gap? And that gap can be filled partially with technology. We have, remote patient monitoring is fairly new in the last few years, but Medicare is now paying for remote patient monitoring in that, patients who are monitoring their blood pressure at home, their blood sugar, if they're diabetic, their weight, right? And different vital signs. That data can be uploaded onto the cloud, onto a platform that physicians or the staff of the physicians have access to remotely monitor how our patient is doing within that 6 months that I have no clue what's going on. So I believe technology is very important. I think the other important thing is to bring on a team so that it's not between the doc and the patient, but it is the care is between the doc and the patient's team. And perhaps that team includes a health coach who can have conversations with that patient, whether it's once a month, whether it's once a quarter, or even once every 2-3 weeks if that patient's health status is not under good control. I truly believe this needs to be a team approach, and that health coach has been trained to educate our patients, right, on the daily activities, nutrition, lifestyle, things of that sort.
Dr. Trin, it's almost like there is a huge body of information, and there's articles, and there's a lot of stuff out there on the web. But it's almost like I feel the conversation has to be micro conversations around preventative living. Like every day, there's a little bit of information you get, and it becomes an everyday part of your life. Like sugar is one small example, right? Today, I talk about sugar and say, okay, let me be aware of my sugar intake today. Tomorrow, it could be about something else, and day after something. And these are micro informations coming to me so that I start learning. But it's not about learning; it's about behavior change. It's about incorporating that information I'm learning from you today into my life.
Absolutely. Information is free. You can find any information you want you go to YouTube, you can learn anything you want for free on YouTube, right? But if information is free, why is it that we have these health issues in America? Why is it that diabetes is a huge issue, obesity, heart disease, when information is free? So information is not enough. What we need to create a system for two additional things besides information. Information is number one. We need a system for support, and we need a system for accountability. Information is free. We have the information, but there's no change. So you need to provide that health coach, right? That additional team member to support your patients, to advocate for the patient, and to keep patients accountable.
Dr. Trent, I want to draw attention to something very noble that you're doing. You, with other medical practitioners and volunteers and students, you travel around the world providing health services to people who don't have access to it.
I started a nonprofit organization, a 501c3, a few years ago. I don't know if you remember the Vietnam War. The Vietnam War ended on April 30th, 1975. I was a 5-year-old boy at the time. And on April 29th, 1975, one day before the end of the war, I was rescued on a U.S. helicopter. Just like the Afghanistan rescue evacuation a few months ago, I was rescued in the same helicopter, by the way, the Chinook helicopter. And so it was like, I was 5 years old, but I remember the war. I remember the devastation and all that, even as a kid. And I'm just so grateful to be given the opportunity to become a physician, to go through education and to be successful. And so I launched this nonprofit organization. It's called Tongue Out. It's got a funny name, like sticking your tongue out, like a medical exam, tongue out. And so every year we are in Vietnam. We do eye surgeries for the blind. We work at leprosy colonies. We work at orphanages and pop-up clinics. Every year we're in Haiti. We're in Peru. We're in Mexico. And so, it's a way that I've been blessed. So just an opportunity to give back.
Dr. Tring, now you've set me on fire with that little boy getting on that Chinook in 1975. Were you getting on that Chinook alone with no parents? How did you end up in the United States?
I got on there with, I was the oldest. There was 4 of us siblings. I was 5. My sister was 3. My other sister was 2. My brother was 3 months old, and mom was with us. Eventually, there was a helicopter that landed, and it was for us, and we were told to run toward it. And I grabbed my sister's hand, my 3-year-old sister. My mom had the other 2 siblings in both hands, and we ran into the helicopter. We sat down on the left side, buckled up, and I remember the entire experience.
And where did that helicopter land? Where did it go next?
It landed on the USS Midway, an aircraft carrier.
Wow, 5 years old, you went on an aircraft carrier?
Yes, I was on the Midway on April 29th, 1975, and that's how I was rescued.
What an incredible story.
And then you headed for the United States.
Yes, from the Midway, they put us all into these little small landing crafts. The landing craft left the back of the Midway, and we're just bobbing up and down the water. No clue where we're going. So that landing craft met up in the middle of the ocean with a transport ship. It was a transport ship, and I remember jumping from the landing craft and catching on to the ropes that were let down on the side of the ship, and then grabbing it and then climbing up the ropes. And all the refugees were jumping and grabbing onto the ropes, and I remember they were tossing little babies from one ship to the other, catching babies. And so we slept on deck on the transport ship, just on the deck for at least a week. That transport ship dropped us off at the island of Guam. So we lived on the island of Guam among the military, the Marines and all that. We lived in these little Quonset huts, these little half-dome huts. And we lived there for a few months. And we weren't allowed to enter the United States unless we had a sponsor. And, we didn't know anyone, so we had no sponsor. But one day we were told that we had a sponsor. And we're like, wow, who would sponsor us? And so it was a church that sponsored us. It was very interesting. It was a Christian church that sponsored us. And because we had a sponsor, they flew us over from Guam to Orange County, California, at an air base, and then they put us on these big, long black buses and took us down to a big Marine Corps base called Camp Pendleton in Oceanside, and we had lived there among the Marines in these big tents that were set up. And then, by the way, when I turned 18, I joined the Marine Corps, just as a way to give back. And then
you are such a happy, lovely man, aren't you?
Incredible. A very lovely and inspiring story, Dr. Trinh. What we do is in our conversations, we always end with a call to action. And this conversation has invoked a lot of thoughts in my mind, inspired by your life and your story and the way you're looking at the world of care, which very, very, resonates with my thinking. And, my take is that everybody, I ask you today, that every day that you wake up, get some micro information, which, like Dr. Trinh said, information is free. There's plenty of it. Find some micro information that is germane to your wellness and say, how can I understand it? How can I dive deeper into it? Think about it. Be mindfully thinking about it and incorporate that into my life today. Dr. Trinh, what a pleasure having you on the call, on the conversation today. It's been very informative. Your life story is inspiring. I would suggest there should be a documentary made on you from a person coming from Vietnam, the story of getting to the US, giving back with the Marine Corps, going into wellness, which is probably going to save humanity. But that's a story worth telling. Thank you.
Thank you. I appreciate this opportunity, and I'm available to come chat with you guys anytime you need me. Thank you so much.
Thank you, Dr. Trinh.
Thank you, Dr. Trinh. For more information on Dr. Trinh, please visit healthtalksoc.com. What a lovely story. What a lovely man.
Beautiful man. And what a story getting out of Vietnam in 1975. My goodness.
This guy's got goodness written all over him. He's in gratitude. He is thankful. He's hopeful. He's doing the right thing. He wants to do the right thing by people. Being a doctor, he's thinking outside the box. I love him.
And what did you think, Sonny, when he said patients in the healthcare system only get 7 minutes with their doctor?
And Thomas, you and I have, living in the US, you're in the UK, but I've experienced it all the time. And, when you're in the system and you do not know anything else, you just think, yeah, that's good enough. I've seen the doctor. The doctor has given a prescription or whatever analysis they want to give, and you feel satisfied with it. But when you're more aware of the kind of things we talked about today and the kind of things I learned and the reason I started Round Glass, you will realize that that is, for lack of a better word, BS. That doesn't do it. That doesn't cut it.
And what did you think when he talked about the research around Alzheimer's and food and memory? Because I thought it was quite amazing that it was heart cancer and then Alzheimer's directly related to what you consume.
It was eye-opening for me, right? I've always, of course, I'm not dealing with Alzheimer's directly in my family, so kind of it's a bit like it happens to somebody else. But the fact that, food and other elements of well-being is so germane to fighting and preventing disease, I think it's my question to everybody is, why not? If it helps, or it can help, and it can only do good for you even if it doesn't help directly, why not? And I think that the conversation about how elements outside of a traditional healthcare system can help us fight disease, prevent disease, cure disease, lead a better life, just kind of the markers that you can get ahead of time so that you don't fall off a cliff. I think that's a conversation we all need to have.